knee pain, tightness, locking out, giving way. These are massive problems that many of my patients and clients have dealt with. And that's why I've spent the last 13 years as a physical therapist and strength coach trying to figure out which exercises are best at helping people recover from knee problems. And the issue with knee pain is it's not a one-size-fits-all approach. There aren't magical exercises that fix all knee pain. Say you have 3 people who have knee pain in the same area, but one's bow-legged, the other has knock knees, and the other one has crazy hyperextension. Do you think all of them are going to need the same exercise to fix their knee? Probably not. They all have different movement needs, and they could have different restrictions that could be contributing to their knee problem. Now, I get it, sounds complicated, but I'm going to make it ridiculously simple for you today. In this video, I'm going to show you how to assess for movement restrictions that could be influencing any knee problem you have. And then based on your test findings, I'll give you a sequence of exercises that you can use to address those movement limitations, and 90% of the time that can make your knee feel that much better. So the biggest issue I see when people look at the knee is they only look at the knee. But there's so much more going on when it comes to the biomechanics of this joint. As you bend and straighten the knee, there are rotations that have to happen at the femur, which is related to the hip joint. So if you got issues at the hip joint, that can influence the knee. If we work our way downstairs, the tibia also has to rotate. This area is influenced by the foot-ankle complex. So if you have any movement restrictions in this area, that can also affect what's going on at the knee. So when it comes to figuring out how to address knee problems, we have to look at the hip, the knee, and the foot and ankle, and how those areas work together to determine what the best exercises are to make knees feel that much better. But don't worry, as you go through the testing that I'm about to show you, I'll put it all together based on your results to figure out which exercises are going to be best fit for you. You'll first want to check the hip, specifically external and internal rotation. Lie on your back with one knee bent and the other leg straight. You'll want about a fist distance between the foot that's bent and the leg that's straight. To test external rotation, let your leg fall to the side without letting your opposite hip lift off the ground. If your knee is 2 fist lengths away from the ground, you're probably limited in external rotation. External rotation is related to knee bending, so that can influence how well knee flexion or bending occurs. To test internal rotation, keep your leg in the same position, but let your knee try to go across the middle of the thigh. If you can't pass the thigh, then you're likely limited in internal rotation. This can influence straightening or knee extension. Now that we got an idea of what's going on at the hip, we want to work our way down to the knee itself to see how these rotations play out. We're going to look at flexion or bending and extension or straightening. Now, if I have people self-test, especially when I'm working with people remotely, I usually do these during more active movements. To test bending, stay in the same position that you were for your hip range of motion testing, only this time try to slide your heel all the way to your rear. If your heel is more than 2 fist lengths away from your rear, you're probably limited in knee bending. For knee straightening or knee extension, we're going to look at an active straight leg raise. Lie on your back with both legs flat. Keep the knee straight and lift your leg up. You're shooting for about a 70 or so degree angle. If you notice that you can't straighten your knee all the way, or as you lift up, your knee begins to bend, chances are you're limited in knee extension. Lastly, we're going to look at foot posture, and we want to see if someone has a higher arched foot, which is biased more towards external rotation of the tibia, or if they have a lower arched foot, which is biased more towards internal rotation of the tibia. And you can do this right after you get out of the shower. All you need to do is get the bottom of your foot damp and step on the ground or a piece of paper. If you can see a good-sized arch, you're likely biased more towards external rotation. This is especially true if you see only back of the foot and the front of the foot. That means you like hella bias towards external rotation down low. If your foot is flatter, or it's kind of more that pancake foot where you see the whole foot on the ground, then your foot and your tibia are biased more towards internal rotation. Great, we got all this information. What do we do with it? It's actually quite simple. It boils down to 3 things in a specific order. First, you have to gain the motions that you lack in the knees and the hips. Can't bend your knee, you gotta work on bending. Then, you gotta learn how to produce those motions at higher intensities. And the last thing, which seals the deal, is to bias the foot based on its resting position so it can go through the full sequence of supination, external rotation, to pronation, and resupination. You do those things, your knee problems are gonna feel a whole lot better. Let's first tackle step 1, fixing mobility restrictions. Here, you have to figure out, were you limited in hip external rotation, internal rotation, knee extension, or knee flexion? If you were limited in everything, I would recommend starting by improving hip external rotation and knee extension first, then going after hip internal rotation and knee flexion. And if you stick around to the standing progressions that can help you gain mobility in these areas, I'll show you how you can influence foot positioning to get your results like, whoa! Let's first talk about improving knee extension or straightening. To do this, the tibia, this is the right leg, needs to be able to externally rotate, and the femur distally or at the knee joint needs to be able to internally rotate. So we can use our hands to facilitate this action, and I like doing a step back to do so. Now, because you're standing with this exercise, you can do different things with the foot to bias the motions that it lacks. If you're someone who's got a crazy high arch, you were that person who you can only see the heel and the tips of the toes on the ground, you would do well with this exercise by putting something under your heel only to elevate it. That's gonna allow you to flatten your foot more easily. If your arch is kinda high, but you can see at least the outside of the foot, you would do well on flat ground. And if you're someone who has a flat foot, I would recommend doing this movement on a ramp. That will shift your weight back so you can restore some of your arch. Getting your foot set up how you want it, you'll take your outside hand and grip the thigh. Twist the thigh inward to drive that internal rotation. Take your inside hand, grip the shin, and you want to twist the shin outward. This helps restore knee extension. Keeping your weight on the inner heel and the ball of the big toe without tipping the foot, you're going to inhale quietly and step backwards. As you step backwards, make sure that you're not just straightening your knee, but you're allowing your hips to move back as well. Exhale, back to the start. Inhale, step backwards. Exhale, back to the start. Try this movement for 2 to 3 sets of 10 reps, being slow and controlled throughout. Now, if you were limited in knee flexion, you do the opposite motion. You need to drive tibial internal rotation and femur external rotation. You can do this by placing your tibial tuberosity, which is the bony part that's on the front of the shin where your patellar tendon attaches, on a foam roller. Twist the leg inwards so the tibia internally rotates. Then, you're gonna inhale quietly through the nose and bring your heel towards your rear, maintaining that twist. Exhale, back to the start. Do this for 2 to 3 sets of 10 reps. Now we can really amplify our knee range of motion by applying this into a split squat with a twist. If you can progress to this, I found incredible changes with knee motion. And you can bias it depending on whether you're that person who needs more knee extension or knee flexion. All you need is a foam roller. Drop down into a split squat, making sure that your foot's pointing forward and your weight is heavy on the inner heel and the ball of the big toe, again without tipping the foot. Now, if you're someone who needs knee flexion, you're gonna place that foam roller on the outside thigh, and then the foam roller is gonna be up against the wall. Keeping the foot flat, you're gonna press your knee into the foam roller. If you're someone who's limited in knee extension, you're gonna flip around. This time you want the foam roller on the inner part of the thigh, and keeping the foot flat without tipping it, you're gonna press your thigh into the foam roller. In that case, your groin's gonna work. In the other case, it's gonna be more glute heavy. You'll hold this position for 3 to 4 sets of 30 to 60 seconds, making sure you quietly breathe in through the nose for a 5 count and softly exhale through the mouth for a 5 count throughout. Now those will take care of a lot of knee restrictions, but if you don't address the hip rotation component, it's probably not going to last that long. Because remember, hip rotation affects what's going on at the knee, because the knee is a rotational joint. So if you're limited in external rotation, I like starting with a frog position. Line your back with your waistband flat on the ground, feet together and knees apart. If you notice that your back is arched, you don't want to tuck the hips and force the back down. You want to straighten your knees. That's going to counterweight your body backwards, so that way the waistband area and the low back flatten into the ground. Place your arms at about 100 to 120 degrees of shoulder flexion with the palms facing upward. You're going to take a quiet breath of air in through the nose for a 5 count. During the 5 count exhale, reach your arms at diagonal. That's going to help your lower back flatten into the ground, which can help improve external rotation because of the change in pelvis position. Maintain that reach and do those same slow 5 count inhales and exhales for 3 to 4 sets, 30 to 60 seconds. You can progress those hip external rotation gains, and it will help with knee bending if you do a wall squat. Because you're standing, you're going to apply the same logic that we talked about in earlier moves when it comes to the foot. If you're someone who's got a crazy high arch, you'll want to put something under the heel only. If you have a moderate arch, meaning you can see the outside border of the foot, then you're going to do this on flat ground. If you're someone who's got a crazy flat foot, you got that pancake, then you'll want to do this on a ramped surface. Stand about 1.5 to 2 foot lengths away from the wall with your waistband area resting against the wall. If you notice that your waistband is not touching the wall, step out a little bit further. Squat down slightly, keeping weight on the inner heel and the ball of the big toe without forcing. Looking straight ahead, you're going to bend the arms upward like you're holding a jacket over your shoulder. Take a slow 5 count inhale through the nose. During the exhale, which should last about a 5 count, use your heel and ball of the big toe to push your waistband and lower back into the wall without forcing. You do not want to crunch. This is going to shift your weight backwards, which will help improve external rotation. You want to do this at about a 3 to 4 out of 10 effort at the most and maintain it. Hold this position, doing those same slow breaths for 3 to 4 sets of 30 to 60 seconds. Now, if you're limited in hip internal rotation, you'll want to do strategies where you're putting weight through the ground. This helps influence the mechanics not just in the hips but in the pelvis to produce internal rotation. Start by lying on your back with your feet flat on the ground. Your waistband should stay flat on the ground without forcing. If you notice that it's hovering in the air, place a couple books or a box underneath the feet. Just make sure you bend your knees a little bit more because you want to keep the foot flat. Making sure the waistband does not move. You're going to press your inner heel and ball of the big toe straight down. This will engage the hamstrings. It's not going to be a crazy contraction. It should be maybe a 3 to 4 out of 10 effort at the most. Hold this position and do a slow 5 count inhale through the nose and a soft 5 count exhale through the mouth. Stay here for 3 to 4 sets of 30 to 60 seconds. To progress this to a standing variation, try a box squat. Now, because you're standing, you can influence your foot positioning based on what you need. If you got a crazy high arch where you see only the heel and the front of the foot on the ground, you'll want to put like a small plate underneath the heel only. If you see most of the arch but it's not like completely flat, then you just want to do this on flat ground. If you're that person who's got a way flat foot, I would do this on a ramp. Toe out slightly. You want to start an external rotation. Don't worry, as you drop down into the box squat, you will bias internal rotation. Keep the knees soft. You want about a 10-pound or 5-kilogram plate in your hands. Take a quiet breath in through the nose. During the exhale, you're going to reach the weight forward. This will help shift your weight backwards so you can get into the hips better, which can improve your hip mobility. From here, inhale and slowly drop down to the box. It should take about 3 to 4 seconds. Same thing with the inhale. Once you touch the box, you're then going to exhale and come back up. Make sure when you land on the box, you don't lean back like you're Fat Joe, because I'll tell you what, his hip mobility is probably whack, even though his bars are not. What? You also don't want to arch your back as you lower down. This can be easily fixed by making sure that you keep your arms at 90 degrees of shoulder flexion. Most people let the arms raise up, and that's what screws up the movement. And the last thing is you don't want to overly lock out at the top. I generally coach most people to keep the knees soft. So inhale, slowly sit down towards the box, making sure you let the knees bend. Exhale, come back up off the box. Do 2 to 3 sets of 10 reps for this movement. Now we've done a bunch of stuff to gain motion in the knee and the hips, and a lot of times that can get knees feeling more comfortable. But the problem is this might not transfer to higher intensity activities. You gotta use this stuff in those higher intensity movements. And there's two things that I like to coach my patients and clients through to help use the motion that they've now gained. The money move for me is a split squat, and that's because you can bias it towards more external or internal rotation depending on what you need, and you generally go through both of those rotations in that movement. To determine which variation is best, you first want to look at your foot. If you're someone who has a really high arch and you only see your heel and your toes when you leave your footprint, you'll want to put something under the heel only, like a small book or a plate. If you're someone who's got, a normal arch and you can see the side of the foot, it's not super flat. Flat ground's generally pretty good. If you're someone who's got a flat foot, I typically recommend using a ramp because that will at least give you some arch back. Now you can also change the rotational bias of the split squat depending on your goal. If you want to bias it more towards external rotation, perform a front foot elevation. If you want to bias it more towards internal rotation, perform a rear foot elevation because that puts more weight through the front leg. And then a split squat just on the ground kind of gives you the best of both worlds. The way I think about this is if I have someone who's limited in a specific motion, I want to start them within the range that they have and then eventually work towards the range they don't have as we've gained mobility. For example, let's say you're someone who has a good amount of hip external rotation, but you're limited in internal rotation. You'd probably be best served to start with a front foot elevated split squat because that reduces the amount of IR. And then as you get better, you go to flat ground and then you go towards a rear foot elevated split squat because hopefully as you've gone through these movements, you've improved your internal rotation. To perform a split squat, keep your eyes forward and your knees soft. You want to shift your weight backwards a little bit so you're starting in a negative shin angle. You don't want the shin to be vertical. Holding a weight out in front of you, you're going to inhale and push the front knee forward and the back kneecap down towards the ground. Exhale, come back up. Inhale, drop down. Exhale, come back up, making sure that you don't overly lock out the knees at the top. You can start by doing 2 to 3 sets of 8 to 12 reps of this exercise, but as you get better at it, you can progress it to heavier weights and therefore lowering the rep range to anywhere from 4 to 6 reps. Now, split squats are a money exercise for knee health and can take care of a lot of knee problems, but the one issue with them is they're not at high speed. To make sure your knees stay healthy when you're doing higher force and high speed activities, you need to work on more explosive movements. Jumping is a great place to take care of this. And for most people, when I'm returning them back to activity, I start them with some sort of box jump variation. And to get the most out of the box jump, you can bias this exercise based on what rotation you have more of. If you're someone who has external rotation for days, you'll probably want to do a tap jump, meaning you're going to dip down quick, just tap a box behind you and then jump up to the box. On the flip side, if you're someone who's biased more towards internal rotation, you'd probably do better starting from a seated position because internal rotation is biased more towards force production. You can use more muscular effort to complete the jump. Regardless, the key with this exercise is teaching your body to decelerate, making sure that your knees can tolerate the landing. So with the landing, you want to make sure that you land toe to heel with the foot flat, you have a slight knee bend, and you land softly like a ninja. Perform 3 to 4 sets of 5 jumps, making sure you stick the landing for a 3 count. Now, it's not uncommon for people who've had knee problems to also have some issues at their hips. That sounds like you. I'd check out this video right here because it goes through the exact same process, only this time we're focusing on fixing a lot of your hip problems.